Welcome back. This is Dr. Jin Sang, where clinical excellence meets excellent results. Today we're going to talk about menopause, hot flashes, and the herb black cohosh. So let's get right into some of the benefits, some of the adverse effects, as well as the dosages that you can utilize to help with certain conditions. So let's get right into it. Black cohosh is an herb native to North America. And in the olden days, the Europeans would come over and they took this herb back to Europe and they often used it medicinally. And even to this day, they use it in Europe as well as in Germany. Okay? Preparations are made from roots and underground stems. They're called rhizomes. In the indigenous cultures, back in the old days, they used it for muscle pain, fever, cough, delayed labor, and menstrual irregularities. Now, recent studies have shown that black cohosh is a phytoestrogen, so it has an estrogenic effect. The other mechanism would be that it has a modulating effect or balancing effect on hormones rather than increasing or decreasing estrogens. Okay, so let's get right into some of the uses. Uses: fertility. Studies suggest that it works similar to ethinyl estradiol, and they use this in conjunction with another medication to help with ovulation and pregnancy. PCOS, so polycystic ovarian syndrome, most common cause of infertility. With polycystic ovarian syndrome, you're going to have an elevation of testosterone, so a skewing of your female hormones, so higher estrogen levels. Those people might have facial hair growth. They can have insulin resistance also as a result. One of the best things for polycystic ovarian syndrome would be modulating the insulin resistance and clearing out the excessive hormones like testosterone. Menopause, hot flashes, mood swings, night sweats, sleep disturbances, they can all be modulated to a certain extent with black cohosh. Now, black cohosh doesn't work for everyone, but it works for a good percentage of people. May improve insulin resistance, going back to PCOS, or polycystic ovary syndrome. So when you have difficulty getting pregnant, or you have irregular menstruation where you're skipping a month, or you may go 6 weeks, or you may go 3 weeks and then 8 weeks. When you have irregular menstruation, it's difficult to get pregnant. So sometimes people don't realize why they have irregular menstruation, and they never check to see if they have insulin resistance or elevated testosterone level. So a way to check that is to see if you have a fasting morning glucose elevation, see if your hemoglobin A1C is elevated. You can do a fasting insulin also, or a C-peptide, to determine if you have insulin resistance. And then you can also check for testosterone levels in the blood. You can do total and free testosterone to determine if you have PCOS. Okay, so that's a very important one because it's the most common cause, right? PCOS. It also reduces the risk of osteoporosis. So oftentimes when women go into early menopause, right, in their 40s, early 40s, their OBGYN might put them on estrogen therapy. And the reason is estrogen is needed for bone growth. So to prevent osteoporosis, you can actually use black cohosh, and it reduces the risk of osteoporosis. So females who go into early menopause, or if you're concerned about osteoporosis, you can utilize black cohosh. It also minimizes uterine fibroids. Now there's other things you can utilize also for fibroids, but in general, these are the 6 things that can be helpful for. Now, generally, black cohosh is pretty safe. Side effects can be cramping, headaches, a rash, spotting or irregular spotting because of changes in estrogen levels, weight gain. Rare is liver damage. Now, I want to stress that the liver damage portion is pretty rare. You want to use a company that is third-party certified and they have good manufacturing processes, because you need the proper black cohosh extracts. You don't want to go with some cheap company that gives you high dosages and you don't know the standards of that product. So a reputable company is definitely needed when you're using any type of herb. Okay? You need to consult a physician if you have breast cancer or a history of breast cancer or uterine cancer, as well as endometriosis, because estrogen-driven cancers can proliferate. So you want to be careful with that. So always consult a physician if you have history of breast and uterine cancer. Dosages can be anywhere from 20 to 100 milligrams per day. Probably a sweet spot could be 30 to 50 milligrams, but you need to kind of test it out. Go with lower doses first, and then gradually increase to the dose that would make your symptoms subside to a certain extent. All right. So now, black cohosh is not the cure-all, but it's been used pretty effectively in the functional medicine world. You can use it in conjunction with other supplements that might have a phytogenic effect, that can have a synergistic effect to positively impact perimenopause or menopausal symptoms. All right. My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.